The silent threat. Why heart health is the most overlooked issue in women's wellness for many women. Health is often discussed in terms of reproductive wellness, hormonal balance, or mental health. However, there is a much more lethal reality often left out of the conversation. Heart disease is the leading cause of death for women, killing more women than all cancers combined. Despite these staggering statistics, including the fact that 1 in 2.6 women die from coronary artery disease, CAD, cardiovascular health remains underrepresented in female-centric medical discussions. This gap in awareness, combined with a medical history that has historically focused on male physiology, creates a dangerous environment where women's symptoms are frequently dismissed or misdiagnosed. The gender gap in diagnosis historically, clinical guidelines and diagnostic tools were developed based on male patients. This has resulted in a textbook definition of a heart attack that rarely matches the female experience. While the stereotypical image of a heart attack involves crushing chest pain and sudden collapse, women often experience much more subtle, quiet symptoms. Because these signs do not fit the classic profile, women are often less likely to receive preventive recommendations or aggressive treatment compared to men with identical risk profiles. Why midlife is a critical turning point. The transition through perimenopause and menopause represents a major shift in cardiovascular vulnerability. This is due to two primary factors: the loss of estrogen. Estrogen acts as a natural protector for the cardiovascular system, helping to maintain blood vessel flexibility and reducing plaque buildup. As hormone levels decline during midlife, this protection vanishes, causing risk levels to spike. The impact of chronic stress. Women in midlife often carry a heavy mental load balancing careers, caregiving for children, and supporting aging parents. This chronic stress contributes to high blood pressure, increased inflammation, and disrupted sleep, all of which compound cardiovascular risk. Recognizing the quiet symptoms, because women are more likely to experience coronary microvascular dysfunction, a condition affecting the heart's smaller vessels that often doesn't show up on standard angiograms. Their symptoms can be vague and easily mistaken for aging or stress. If you experience the following, do not dismiss them as mere fatigue or indigestion. Unexplained, persistent fatigue, shortness of breath during mild activity, nausea, vomiting, or indigestion, often mistaken for acid reflux, discomfort in the neck, jaw, or upper body, sleep disturbances, or dizziness, pressure in the chest, rather than sharp pain taking control. A proactive action plan understanding your risk is not about living in fear. It is about gaining the agency to change your health trajectory. To move from reactive to proactive care, focus on these 3 pillars. Know your numbers. Standard labs are a starting point, but they don't always tell the full story. Track these essential metrics. Blood pressure. Aim for approximately 115/75 mmHg. Metabolic markers. Fasting glucose below 100 mg/dl and HbA1c below 5.7%. Lipid panel. Monitor LDL, HDL, and triglycerides. Advanced screening. Consider asking your doctor about a coronary artery calcium, CAC, scan to check for plaque buildup, or a lipoprotein A test to identify genetic risks that diet alone cannot fix. Prioritize metabolic and AMP. Sleep health. Sleep is non-negotiable. Insomnia is a significant risk factor. Women with persistent sleep issues are significantly more likely to develop heart disease. Eat for inflammation. Adopt a Mediterranean-style diet rich in fiber, healthy fats, olive oil, nuts, and omega-3s, fatty fish, to support blood sugar and cholesterol levels. Move with intention. Don't just focus on cardio. Strength training is vital for preserving muscle mass, which in turn supports metabolism and blood sugar regulation, both of which are critical for heart health. The bottom line, heart disease in women often whispers before it shouts. By recognizing subtle symptoms and advocating for gender-specific screenings, women can intercept cardiovascular issues before they become life-threatening crises.